Welcome back to my channel. Jill here. Today we're talking about all things catworm related, from the many worms that cats can become victim to the symptoms to watch for, and the best treatments and prevention of these worms. Let's dive right in. Roundworms are very common in cats. They get their name from the distinctive shape of their body. They're long and cylindrical with two pointy ends. Their eggs are microscopic, so unable to be seen by the naked eye. The worms dwell in your cat's intestines, and the eggs are passed out in the feces. Roundworm larvae can be passed from mother to kitten when they are nursing from the queen, or mom. Lots of types of small animals and birds can be infected with roundworm larvae. These types of animals tend to be the typical prey for your cats. Therefore, when a cat eats the prey, they become infected. Another way that cats can get infected or reinfected is when they pass out worms in their feces into a litter box that hasn't been cleaned out properly. The cat will transfer eggs from their paws to their mouth as they groom themselves. Litter tray hygiene is of utmost importance when dealing with worms. Now, tapeworms. Most pet owners have heard of tapeworms and possibly have seen them as well. Tapeworms latch onto the inside of the intestinal wall and develop long bodies with distinctive segments. The end of the worm is where the egg sac is. This egg sac breaks off and sheds out the cat's behind. It is these segments that resemble little grains of rice, which owners usually see in the cat's poop or on fecal matter that gets stuck to their fur. Tapeworms usually only affect older cats, unless you have a cat with a large flea burden. All it takes is one infected flea to cause a worm infestation, along with the flea infestation. Tapeworms have an intermediate host in their life cycle, which aids greatly in their ability to get established inside of your cat. Cats get tapeworms when they swallow fleas or ingest a small mammal host. A mouse is an intermediate host. He picks up tapeworm somewhere along the way by eating something else that had tapeworm. When your cat kills the mouse, they ingest part of the mouse, and they now are the host of the tapeworm. So the tapeworm can finish out its whole life and continue to enjoy its life inside your cat until you treat for it. Now, hookworms. Hookworms are smaller worms that latch into the intestinal lining and suck on your cat's blood. They can cause severe anemia and diarrhea, especially in young kittens or immunosuppressed cats. Hookworms pose a zoonotic risk to humans too, as the larva can enter into our unprotected skin, meaning that we can get hookworms from your cat. Hookworms are more common in warm, moist environments. Conditions of overcrowding, along with poor sanitation, contribute to hookworm infection and reinfection. When a cat inadvertently swallows larvae, often by grooming its feet, the hookworm infection will become established. Now on to whipworms. They're less common in cats than some other of the worms. They get their name from their characteristic shape, which is literally like a whip. Cats become infected with the larvae or eggs of the whipworm, including contaminated soil, food, water, or animal flesh or feces. Whipworms reside in the intestinal tract of cats. Cats can get infected with heartworm from a bite of an infected mosquito. The worm burden is usually very low in cats, but it takes only one or two to cause a serious problem. Heartworm disease can unfortunately cause a sudden death in your cat. A big downside for cats is that heartworm treatment is not suitable for them, so prevention is key. I have a video all about heartworms in dogs and cats. I'll put a video link up here. It can also be found in my animal health playlist. Now, before we dive into the treatments, if you found value in this video so far, if you wouldn't mind smashing that like button and hitting the subscribe button, it helps me out a ton. And that way, you don't miss a thing that I put out about your cats, your chickens, or your dogs. Cats can be completely asymptomatic or have symptoms severe enough to the point of being life-threatening. The symptoms of worms displayed by your cat will vary largely depending on the type of worm that they have on board. How to tell if your cat has worms? The most common signs with intestinal worms are diarrhea or changes in fecal consistency, blood in the feces, vomiting, loss of appetite, weight loss no matter how much they're eating, a pot belly type appearance, poor body condition, and a dull coat. Sometimes they have really bad skin issues like irritation on their skin, weakness or collapse, pale mucous membranes, dehydration, and seeing worms in your cat's feces or vomit. If you're witnessing any of these symptoms in your cat, please seek veterinary attention immediately. Now on for treatments for these worms. You might be able to buy some medication over the counter at farm stores. It is so important to keep up to date with worming treatment for you and your cat. Some of the worms I mentioned, such as roundworms and tapeworms, are extremely common. Roundworms can be passed through the mother's milk from the queen to the kitten, so it's a safe thing to assume that all kittens are infected and require regular deworming from a young age. This means starting treatment at 3 weeks of age and continuing every 2 weeks until the kittens are 8 weeks old. They should then be wormed monthly until they are 6 months old. Treatment of adult cats depends on their lifestyle. Adult cats that don't go outside or hunt should be treated every 3 months, and cats that are avid explorers and hunters should be treated every month. If your cat has fleas, it is important to use a product that is active against Diphylidium caninum, which is a type of tapeworm spread by fleas. Your veterinary office may prescribe any of the following antiparasitic agents to terminate worms in your cat. Many medications are effective in worm treatments in cats. The most common medications is Drontal. Drontal is a broad-spectrum dewormer for tapeworms, roundworms, and hookworms. It can be given to cats and kittens over 1 month of age, and they have to be 1.5 pounds. This medication is given directly by mouth or with a small amount of food. The directions are on the label. There's another medication called Profender, which is a topical treatment for those cats that won't eat a pill easily for you. Treatment for roundworms, hookworms, and tapeworms in a single monthly topical dose. There's no pilling required. You part the fur and you place it along the skin on the back of the cat's head. Heartworm. As I mentioned before, heartworm is only preventable in cats because treatment is not suitable for them. So keeping your cat on a topical flea and tick and heartworm preventative is key to avoiding heartworms in cats. This medication that I'm recommending is called Revolution Plus. It is only available with a prescription from your veterinary office. Another topical treatment for cats would be the NexGard Combo. It treats fleas, heartworm, hookworm, ticks, roundworms, and tapes. It is topical application, and you'd use that once a month. It is only available with a prescription from your veterinary office. After your cat has undergone heartworm testing, this is to make sure that they are not infected with it already. If you give the medication before testing and there are worms present, this could really harm your cat. There are lots of medications that can treat all different kinds of worms in your cat. Fenbendazole, or a drug called Panicure, milbamycin omite, or Interceptor, moxidectin, and imidaclopramide are the 2 drugs that are in Advantage Multi. When your kitten comes into the veterinary office and they're given a small amount of liquid in a syringe in their mouth, this is often the medication called Pyrantel. As your cat ages, it is pretty safe to assume that they will at some point come in contact with worms, whether they've eaten a mouse outside or one that has gotten inside when the weather has turned. If you're going to use a treatment at home, the drugs I would recommend would be Praziquantel and Pyrantel, both given orally. The dosages for both of these drugs can be found on the packages. Being a cat owner means that you're going to come across worms at some point in your cat's life. If you aren't proactive with worm treatment for your cat, it can quickly become a serious health issue. Flea prevention also plays an important role. It is always a good practice to deworm your cat regularly, whatever their circumstances are, whether it's indoor or outdoor. Now that we have learned the most common parasites that cats can get and how to treat for them, the next thing we should do is head on over to this animal playlist up here. I'll leave a link for it up in the top, and I'll see you over there. Remember, I'm here for you. You're here for your pets. Have a great day.